Hi, I'm Dr. Bruce Evans. I'm an orthopedic surgeon at St. Mark's Hospital here in Salt Lake City. I specialize in shoulder, hip, and knee type surgeries. Stem cells are being used right now for injections. And right now we're getting the stem cells from either the patient's own body, you can get them from the hip in the form of bone marrow. You can get them from fat in the body. They also found stem cells in fat, or you can get them from the blood. And so the second source is usually from the placenta after childbirth, and they are getting some stem cells from the umbilical cord. And what they do is you procure these stem cells, and then we actually rate them as to how many stem cells are in a certain amount of injectable, and then we inject them into the joint. The second type is called PRP, and that's actually platelet-rich plasma. Now that's much more commonly used today. That's because we can draw it right from your arm, and we pull out just about 60 cc's of blood, and then we can spin that down and pull out just the platelets. And the platelets actually have growth factors in them. And so those growth factors are what we can inject inside a joint that then allow improvement in the joint, both in pain and swelling. Right now we're using PRP on a regular basis on patients that have failed other injection therapies such as cortisone injections, where they failed what we call hyaluronan injections. And as oftentimes we are using PRP as sort of a third type of injection. So we prefer to start with steroid, then this hyaluronan, and then finally the PRP injections.